to Dr. Dipak Joshi to Man Ki Baat. Today we have got a very important, very prominent doctor, well-known doctor from Ahmedabad, urologist doctor, who would speak some on particularly Men Ki Baat. We are promoting men's health awareness, so he would speak on a prostate health tip. So we welcome Dr. Dipak. Dr. Dipak, over to you.
Thank you. Thank you, Reddy's, for the such a great supportive initiative for prostate health and men's health initiative. Today, I'll be describing regarding prostate. Prostate gland is around a 20-gram lemon-sized gland situated just behind our pubic bone, that is behind our penis. It is in the lower part of the abdomen. Normally, prostate gland's role is to produce semen and to produce hormone which is responsible for man's characteristic. Semen is important for the production of the child. So as the age advances, say around 30 years or 40 years of age, next slide. This is the bladder, and lower down the pink size is prostate. As the age advances, the prostate size increases because of the glandular hypertrophy. The cells in the gland prostate increases, and at outside there is a capsule, so prostate cannot grow outside, so it will grow inside, and that is how it compresses the urinary passage. And that is how after age of 50 years men start getting symptoms of prostates. So what are the symptoms of prostate gland enlargement? The symptoms of prostate gland enlargement are poor urinary flow, straining during urination, hesitancy like prolonged voiding, patient start passing urine drop by drop. Then he has increased urinary frequency. Then he has urgency, like he cannot hold urine for long time. He has to go for urination because of the hypersensitivity. Then what are the signs? Signs are, when you how will you investigate the prostate? Prostate is usually benign type. Benign means there is no cancer. There can be cancer in certain 10% of the population of BPH. So when there is enlargement of the prostate, usually the symptoms which I have mentioned, that are the symptoms. So how will you evaluate? So when patient comes with these above symptoms, then we have to evaluate whether these symptoms are because of the enlargement of the prostate, or these symptoms are because of the age related changes into the body, or because of the some neurological conditions, or some bladder muscle problem. So if patient is having symptoms of prostate, and if we diagnose by investigation that this is only because of prostate, then we go for medical treatment, or then we go for surgical treatment. So how will you investigate? Once patient comes to us, then we first ask history. What are your symptoms? The symptoms which I mentioned, again I will narrate: that poor flow, straining during maturation, prolonged voiding, intermittency like passing urine drop by drop. Then he has to go for multiple times in the night times. Then he has to go frequent urination. Then he may develop some pus into the urine, or sometimes blood into the urine. So once these are the symptoms, then we do physical examination. In physical examination, we check for whether his bladder is full or not, whether his patient is retaining urine into the bladder or not. And then we do digital rectal examination, which is very important examination. That will differentiate whether this patient is having malignancy, means cancer, or he is having benign, means no cancer into the prostate. Then we do certain blood tests like serum PSA, serum creatinine. This test will differentiate whether this prostate is causing problem into the patient, whether this prostate is causing damage to the kidney, or whether this prostate is causing any harm to the body or not. Then after we do sonography of the patient, that sonography will help us to differentiate what is the size of the prostate, what is the back pressure changes into the kidney, whether any effect on the urinary bladder is there or not, and any other symptoms like any other cause like stone or some tumor or some other urinary infection is there or not. So after sonography and blood test, we differentiate all these patients in three categories. First is those are who are having mild symptoms, then those who are having moderate symptom, and then after those who are having severe symptoms. Those who are having mild symptoms, usually we advise them for lifestyle modification. Then after we advise them for some regular exercise, then some fluid restrictions in the evening hours. Then we stop certain drugs which is causing a lot of urination. Then after we advise them to do regular yoga and some exercise. This will help patient to alleviate their initial symptoms, fluid restrictions, and change in the antihypertensive drug or certain drugs which causes lot of urine production. So this will help patients in managing their minor problem. Then after we advise those who are having moderate symptom, then we advise them to go for medical treatment, that is 5-alpha reductase inhibitor. That drug will help in reducing the size of the prostate. Like those patients who are having prostate size more than 40 gram, in that situation we give 5-alpha reductase inhibitor. That hormone will be, that drug will reduce this 5-alpha reductase hormone, and that helps to decrease the size of the prostate. And as the size of the prostate decreases, usually patient symptom improves. Then after, if those patients we gave sometimes alpha blocker, that is tamsulosin, then silodosin, and certain anti-infective drug. Then after those patients who do not have improvement even after medical treatment or severe symptoms, in that situation we offer them surgery. Surgery is of endoscopic type and open type, but nowadays most of the time we do endoscopic surgery. So these are the treatment options available to the patients. So this is regarding prostate, its diagnosis and its treatment. If you have any question, you can ask. Hello.
Yes, sir. Yes, sir. Yes, sir. You are live.
Yes, boys.
हाँ सर તમારે ચાલુ જ છે સર.
हाँ ओके. म्यूट कर दो. Boys, चालू. हेलो. हेलो. हेलो भावेश.
Yes, sir. Yes, sir. You are live,
Sir,
sir. Sir, live છો તમે.
Sir, thank you very much, sir, for your valuable talk, sir.
કેમ ડિલીટ કરી તમે